everyone, and welcome to our Monday Minute. Today we're going to do a quick update on the Home Health Quality Reporting Program. A couple of things regarding the Care Compare site. October of 2024 brought an update to the site, or a refresh of the data. During that refresh, they eliminated the acute care hospitalization and emergency department measures that have historically not only been utilized for Care Compare, but for the Home Health Value-Based Purchasing Program. In its place, we now have the PPH measure, which is the potentially preventable hospitalization measure, and it will be, or started being, publicly reported in October of 2024 and will be utilized in the Home Health Value-Based Purchasing model in January of 2025. They have also released the preview reports for the January 2025 refresh to the Care Compare site. In addition to the data that's already being reported on Care Compare, they have introduced 3 new measures that will begin publicly reporting in January of 2025. Transfer of health information to patient and transfer of health information to provider, as well as the discharge function score. The other thing I wanted to mention today is the release in November or in October of 2024, the payment penalties for any home health agency that is not fully compliant with the Home Health Quality Reporting Program. The Quality Reporting Program requirements include that you must participate in the Home Health CAHPS survey protocols and be fully compliant in the submission of your data. Keeping in mind that you must use a CMS approved vendor to conduct your HHQRP surveys, and if they fail, you fail. So you have to ensure that your vendor remains compliant with submitting data on your behalf. The other element of compliance with the Quality Reporting Program to avoid penalty includes 90% of your OASIS that are being transmitted are considered quality assessments. The composition of a quality episode of care is anything from admission through discharge or transfer, or resumption of care through discharge or transfer. So in order for them to establish that you have quality assessments submitted, you would need to submit both the start of care or resumption of care, as well as a transfer or discharge. If you have submitted all of your starts of care but have never submitted discharges, or at least let's say you submitted 50% of your discharges, then you will be found non-compliant, because 90% of all assessments must be considered quality assessments, which means you have to have a beginning and an end. If you have not been fully compliant with the Home Health Quality Reporting Program for 2023, your 2024 October report would show that non-compliance, and you will receive a 2% penalty for non-compliance in your 2025 annual payment update. So any payments for dates of service in 2025 would include a 2% reduction in payment. If you receive this letter and you feel that the information is inaccurate, you have until November 27th of 2024 to file a reconsideration via email. We hope this information has been helpful today. Healthcare Provider Solutions stands ready to assist with any of your home health or hospice quality reporting program needs. Thank you for listening today, and have a great week.